Well, that's a great question, Anthony. I don't know if there's one thing that's the best medicine, but I think it's a combination of things. And I think, just to give you an example, when my mom was diagnosed with dementia and she started presenting, um, she had a vascular dementia, which left her in a panic mode and a separation anxiety mode, which if you left the room, she thought you left the room forever. And I had to go away on a conference, and I didn't want to leave my mom, um, in the care of my family until I knew that they were able to handle my mom and understand all the nuances it took to take care of her. So I took her to an institution down the street from where I lived, and I was in Las Vegas at at a conference, it was on Tuesday. I dropped my mom off, and it was just for a respite, which means a week or so. That night, which was Vegas time, which was 3 hours different, I got a call Eastern time about 3 o'clock in the morning or 2 o'clock in the morning, saying from the nurse that was taking care of my mom, saying we can't control your mom. Can you help us? And I looked at myself and I said, I'm in Las Vegas. I can't help you. I would love to help you, but I can't. And that's how much of a challenge my mom was, that her mania and her anxiety were so prolific that even professionals that deal with her around the clock in different shifts couldn't cope with the presentation that she had and the energy level that she had. So um, that's where I learned that taking someone out of their environment and what they're used to is so important, to try not to do that, because they're creatures of habit and they really don't like change. And getting my mom back home was the best medicine and the best therapy I ever had, because she was surrounded by people that she loved, caring individuals, and an approach that focused on what my mom could do as opposed to what she couldn't.